Welcome back to Science Exposed, where we like to dig into the science behind, well, everything really, the headlines, anxieties, those weird questions you find yourself Googling at 2 a.m.
Exactly.
I'm your host, and today we're diving into something that's been on a lot of your minds lately, especially the parents in our audience.
Oh, yeah.
Mold.
It's one of those things, right, that can go from, is that just dust, to full-on panic in about 3 seconds flat.
Yes, absolutely. And before we get started, a huge thank you to Dr. Cameron Jones for curating these fascinating and often anxiety-inducing topics for Science Exposed.
He finds the best stuff.
He does.
It does.
Now, if you're finding this information useful, hit that like button, share this episode with someone who could use a little peace of mind about the strange spots in their basement, and subscribe so you never miss a deep dive.
Thank you.
Okay, back to the mold, because it's not just about what you can see, is it?
It's really not, and that's what makes this new research so fascinating. We're talking about a study published in the Pneumology Journal, and it's basically an updated set of guidelines from a whole team of experts led by Dr. Klaus Franzke, an authority in the field of environmental medicine.
Okay, the whole team of experts. So, they didn't just skim the surface here. What surprised you the most?
Honestly, it's how much misinformation is out there about mold. This study found that while mold is incredibly common, it's estimated that up to 90% of homes have at least some mold somewhere. The number of species that are actually dangerous to human health is tiny. We're talking less than 1% of all known mold species.
Wow, less than 1%. That puts things in perspective. And this is the big question for a lot of our listeners, especially parents. What does mold actually do to our health? I mean, we've all heard the horror stories.
Right, and this is where the research gets really interesting. They make a clear distinction. There's no proven causal relationship between mold and most diseases.
Okay, no causal relationship. So just finding some mold in your shower doesn't mean you're doomed?
Exactly. And this is but there's a very strong link between mold and certain respiratory problems. And for those with existing conditions like asthma, mold can be a serious trigger.
That's what I keep hearing from other parents, that their kids' asthma gets so much worse when there's mold around. What specific illnesses are we talking about here?
This research specifically mentions allergic respiratory diseases, things like allergic rhinitis, which is essentially hay fever, and allergic rhinoconjunctivitis, which affects both your nose and eyes. And then, of course, there's asthma. Mold can actually make existing asthma worse or trigger attacks.
Okay, so definitely not something to ignore, especially for families with young kids who are more prone to those respiratory issues. What's actually going on in our bodies when we're exposed to mold?
So mold releases these microscopic spores into the air, and when we breathe them in, our immune system kicks into gear. For someone with allergies, their body freaks out a bit, seeing these spores as a major threat, even though for most people they're harmless.
So it's our own immune system that's causing the problem.
In a way, yes. That immune response triggers inflammation in the airways, leading to all those miserable allergy symptoms. It's our body trying to protect us, but sometimes it overreacts.
That makes so much sense. So it's not about panicking over every little speck of mold, but understanding the potential risks, especially for our little ones. And speaking of risks, you mentioned some pretty specific illnesses linked to mold. Let's talk about those.
This study breaks down the level of scientific evidence connecting mold to different health issues. And what they found is that there's really strong evidence for a condition called allergic bronchopulmonary aspergillosis, or ABPA.
That's a mouthful, ABPA.
Yeah.
It's like alphabet soup over here.
Yeah.
But seriously, what is that?
It's a severe allergic reaction in the lungs, and it's caused by a specific type of mold called Aspergillus.
Aspergillus, that one rings a bell.
It's one of the most common types of mold found indoors, and the reason it's often linked to these more serious respiratory issues is because it releases a ton of spores, millions upon millions of them.
Millions? That's a lot of spores. Okay, so you're a parent. You're hearing all this, and you might be wondering, what does this mean for my home? Should I be scrubbing every surface with bleach?
Hold the bleach for a sec. We'll get to the practical stuff, I promise. But what's fascinating here is that the study found that even with all this mold floating around, the sensitization rate, meaning the percentage of people who actually have an allergic reaction to it, is surprisingly low.
Surprisingly low. How low are we talking?
Across Europe, it's somewhere between 3% to 22.5%.
Okay, so less than a quarter of the population. Still a lot of people, but less than I would have guessed. What's the takeaway for our listeners?
The takeaway is that this research really emphasizes a preventative approach.
Okay, I like the sound of preventative. Tell me more.
It's about understanding that while mold is common, it doesn't have to mean illness. And this is key, you can't ignore it. The researchers are very clear that indoor mold growth, even if it's not causing obvious problems, should never be ignored. It needs to be addressed.
So don't panic, but don't ignore it.
Yeah.
Got it. How do we do that? What are the actual steps we can take?
When it comes to practical steps, this research points to one major thing: moisture control.
Okay, moisture control. Makes sense. Mold loves a humid environment, right? But let's break that down. What does that actually look like for families?
Think of it this way. You want to stop mold before it even starts, and that means ventilation. Especially in those damp areas, we all have like bathrooms and kitchens. Run those exhaust fans when you're showering or cooking open windows whenever you can to air things out. And if you live in a particularly humid climate, a dehumidifier can be a lifesaver.
Those are great everyday tips.
Oh,
I'll admit I'm guilty of forgetting the exhaust fan all the time. But what about those hidden spots? The places we don't always think about?
you're reading my mind. This research actually highlighted checking for leaks, especially under sinks. You'd be amazed how a tiny drip over time can create a perfect breeding ground for mold. And don't forget those neglected areas like basements, attics, even crawl spaces. Proper ventilation is crucial there too.
It's like a mold treasure hunt, but not the fun kind. So we've got ventilation checking for leaks. What else? What if you already have some mold? Asking for a friend, of course.
We've all been there. The key here is to not just clean up the visible mold, but to address the source of the moisture. Just wiping it away is like putting a Band-Aid on a broken bone. It's not going to solve the problem.
Right. You need to figure out why the mold is there in the first place.
Exactly. Was it a leaky pipe condensation on a window? Once you've dealt with the root cause, then you can safely and effectively clean up the mold. And speaking of cleaning,
I was about to ask about that. Are there specific cleaning products we should be using? We don't want to unleash any toxic fumes in the process.
the researchers emphasized using appropriate cleaning products and protective gear, though they didn't recommend anything specific. A good mold and mildew cleaner should do the trick, and always wear gloves and a mask to avoid breathing in those spores while you're cleaning safety first.
Safety first. So we've got prevention dealing with existing mold. But what about those risk groups we talked about earlier? People with asthma, allergies, or weaker immune systems. What does the research say about protecting them?
This study really stressed taking extra precautions for anyone who might be more vulnerable to mold. That includes infants, the elderly, and anyone with a compromised immune system or existing respiratory conditions.
So what can we do specifically to protect those individuals? It sounds like it goes beyond just basic cleaning and ventilation.
It might. This research actually suggests that in cases where someone is particularly vulnerable, professional mold remediation might be necessary. A professional can assess the situation and recommend the best course of action.
Professional help, got it.
Oui.
So the takeaway here is that mold isn't just about aesthetics or a musty smell. It's about understanding that it can have a real impact on our health, especially for certain individuals. But as we've learned, knowledge is power. And thankfully, there are steps we can take to create a healthier home environment. In fact, some of this is just good common sense, isn't it?
Yeah. Absolutely. A clean, well-ventilated home is a happy home for you and for those microscopic roommates we've been talking about.
Speaking of those roommates, this research really went deep into the different types of mold and how they can affect us. It's not all created equal, is it?
Not at all. This study highlighted a particular culprit, Aspergillus, which we touched on earlier. Remember ADPA, that nasty lung infection?
Yeah, Aspergillus seems to be the one to watch out for.
It's one of the most common causes of those serious allergic reactions, and this research suggests that it's not just about having an allergy. Even in people without allergies, exposure to high levels of Aspergillus spores over time can potentially cause other respiratory problems.
That's concerning. So besides the general advice about moisture control, what can people do to specifically minimize exposure to Aspergillus?
Well, for those vulnerable groups we talked about, this study recommends being extra careful about activities that can stir up mold spores.
Like what? Give us some examples.
Gardening, especially if you're dealing with compost heaps, those can be hotspots for mold, or even vacuuming without a HEPA filter. These activities can throw a lot of spores into the air, and for someone with a weakened immune system, that can be risky. Even things like old books and papers can harbor mold, so it's about being mindful.
It makes you wonder what else is lurking in those old books. But seriously, that's really helpful advice. So we've talked a lot about the risks, but this research also emphasized something really important, the difference between mold and mycotoxins. Now, I have a feeling you're going to explain this way better than I can.
Happy toxins. Mycotoxins are essentially toxic substances that certain types of mold can produce, but not always.
Okay, toxic substances. Now that sounds scary. Should we be worried?
It can be, but here's the key takeaway from the research. Not all mold produces mycotoxins, and even the types that can don't always do it. It takes specific
So
conditions.
it's like a double whammy.
Yeah.
You need the wrong kind of mold plus the right conditions for these mycotoxins to even be a thing.
Exactly. This research emphasizes that just because you have mold doesn't automatically mean you have mycotoxin exposure. However, if you're concerned about it, especially after water damage, or if you've been dealing with chronic mold growth, it's best to consult with a professional. They can assess the situation and recommend testing or remediation if needed.
Professional help is key if you suspect those mycotoxins are involved. That makes sense. This deep dive has been packed with information. It's amazing what we learn when we take a closer look at the things we can't even see. What's your biggest takeaway from all of this?
For me, it's that reminder that mold is a natural part of our world.
Right.
It's like it's not about living in fear of it. It's
Yeah.
about understanding the potential impact, being aware, and taking those proactive steps to create healthier homes.
Knowledge is power, right? And it sounds like there's still so much more to learn about mold and its effects.
Absolutely. Research is constantly evolving, which is what makes this field so fascinating. There's always something new to discover.
It makes you wonder what new discoveries are just around the corner. Until next time, stay curious.